Hi, and welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Martinos Magala. He's a medical student, and he wrote the Kevin MD article, Why Medical Students Should Be Taught the Business Side of Medicine. Martinos, welcome to the show.
Thank you for having me. I appreciate it.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yeah, sure. So my name is Martinos Magala. I was born and raised in New Jersey. I'm currently a second-year medical student here in New Jersey at Hackensack Meridian. I've always been interested in the business side of things. In college, I went to NYU. I majored in economics. Although I was on the pre-med track the whole way, I knew I wanted to pursue medicine, but we took enough science classes as a pre-med, so I figured, I get a little diversity and study economics, and that side of things has always interested me.
Wonderful. Have you always had an interest in the business side of medicine?
Yeah, I have. Not so much the business side of medicine before college and med school, but I've always kind of had that business acumen because my whole family is like entrepreneurs and business people. My dad owned a deli for a long time, so I grew up kind of working with him and studying that sort of business and things like that. So I've always been interested in that aspect of things. Yeah.
And just out of curiosity, as you were pursuing your economics major in undergrad, how many of those economics majors were also pre-meds applying to medical school?
At my school with me, I really didn't think there was many. Maybe there was like one or two more. I know that there are some people across the country that do that, and I know some people personally that are friends that have done that. But I don't think it's super common.
All right, so let's talk about that intersection between business and medicine. And you wrote a Kevin MD article titled Why Medical Students Should Be Taught the Business Side of Medicine. Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, sure. So like I said, I've always been interested in the side of things, and especially in college and medical school. Once I, started pursuing medicine, I noticed that there is a huge, kind of business side of it and healthcare economics, personal finance, things like that. So I kind of grew a passion for that. I actually read a lot of articles on your website regarding these kind of topics in this field. So I decided, I've had experience with this. I've learned a little bit about it. So I just wanted to kind of get my thoughts out there, put them in paper, and just see if I could get them out there and kind of let other people see what I was thinking as well.
So, under normal circumstances, what kind of business training do most medical students get?
This is something I talk about a little bit in the article, but I really don't think medical students, at least not in medical school, get really any sort of formal business or personal finance training at all. Like we do have some resources through our schools usually that provide information about loans and loan repayment, things like that. But it's kind of on a very surface level. But there's no real dedicated curriculum or dedicated time spent on talking about any of these aspects. And when I talk about the business side of medicine, I really consider a few things as part of that. So I see as the personal finance and financial literacy part of that. I see healthcare as a whole and kind of healthcare economics, like we were saying, and just kind of how the whole structure works together and how these things kind of interact. For example, at my school, I started the business and medicine club because, like I said, there's kind of like a lack of that integration and training and sort of those kind of things. So through our club, we've had talks from a bunch of different people. We've had financial advisors come in to talk about that personal finance part of it. We've had doctors come in that own and work in private practice, and they tell us kind of about the day to day of that, billing, things that you don't really think about right now, but that you'll have to think about in the future, and just kind of what that's like, giving us a little bit of exposure to that. We actually had the CEO of CityMD, Richard Park, come in and talk to us, and he gave us a whole talk on entrepreneurship and kind of his story, how he got into starting a large urgent care model that he's done. And I've also had a medical malpractice lawyer come in and talk to us because I think that's another thing that it's not necessarily like the business side of medicine, but it's something that is involved in the medical field that is good to be aware of and kind of good to learn about at an early stage.
Now, from your experience, those medical students who take a more traditional route to medical school, taking like a biology pre-med or a science-based pre-med, what is their average level of business and financial literacy?
So I think overall, in the field of medicine, whether you're in college or whether you're in medical school, or even if you're a resident or an attending, I think that the level of financial literacy is unfortunately pretty low because, like I said, we just don't have a lot of exposure to that kind of stuff. So if you're not going out and kind of seeking out ways to learn about it or kind of finding resources to learn on your own, you're never really going to be exposed to it too much until it's kind of a little late. There's been people that have like written about this and studied it, and they found that really the level of financial literacy like in this field is overall pretty low, unfortunately.
So let's go a little bit more granular. What specific aspects of financial literacy is most important for those pursuing a medical career?
I think it's important just to have kind of a basic grasp on things like budgeting, things like how to manage your student loans and repayment options. Think basic things like 401k, Roth IRA, things like that. I think very basic tax knowledge is very important because doctors are incredibly high earners, are one of the highest earning professions in the United States. And so you kind of go to residency and you graduate, get an attending salary, and you're kind of thrown into a very high tax bracket. And you don't really have any sort of formal training or formal knowledge about how to navigate that and how to do that properly.
Now, do they need any specific courses or formal training per se? Is there any other way they could get this knowledge or any books or resources you could recommend?
Yeah, I think there's plenty of ways to get it. I think it would be nice to kind of try to integrate some of these things in sort of medical curriculum, maybe as electives, which I think I wrote about one school that kind of integrates this as an elective during medical students' fourth years. So stuff like that would be good. But besides that, the way I've learned about this stuff is really just using resources. For example, Kevin MD, lots of articles written on there. People like the White Coat Investor, his book is amazing and a lot of people read it. Also on his website, there's articles and kind of walks you through any topic you can think of pretty much on financial literacy and personal finance. And I think just talking to people as well. So personally, what I do is when I'm working with an attending or a resident or anyone in the medical field, obviously we're learning the medicine side of things as well, but I also am not, worried to ask about kind of things like personal finance and more kind of career things and business side of medicine type stuff as well. And they're always happy to discuss it with me. And I think it's a good way to kind of get that firsthand knowledge from someone who's been through it.
Now, you say you run a business of medicine club at your medical school. Now, in general, how much interest is there in the medical students in obtaining some type of financial literacy or seeking out some business expertise as they're going through medical school, knowing how busy they are?
Yeah, that's the thing. It is very busy, but I think actually there's a lot more interest even than kind of meets the eye or that you might think. I think it's kind of a little intimidating at first because it seems like kind of uncharted territory. Just the same way that medical curriculums are intimidating at first, but you learn how to navigate it the more you get exposed to it. But personally, like for our club, when we had our first meeting, I was very surprised at how many people showed up. We had a very large turnout. A lot of people were interested in it. And subsequent meetings after that, there's been a lot of interest. And I think people want to learn about this stuff, but it's kind of, you have to give them a way that's accessible and a way that kind of makes sense and is relevant to what they want to do.
And when talking to faculty members in general, it doesn't have to be your school, but just in general, faculty members, how interested are they incorporating some of the business aspects of medicine in their curriculum?
I think there is interest, maybe not into direct integration, but every time I talk to someone who's in the medical field, they say, I'm learning this stuff now, but I wish I had known it sooner.
Hmm.
So from that side of things, I think that, people would find it beneficial to try to get some of this training done early on. I was talking to a doctor the other day that I work with, and he was telling me that he had bought the White Coat Investor course and he's waiting to kind of dig into that and figure out how to, manage the finances and do things like that. So I think people are always, they want to learn about it and they want to try to, explore that side of things and have it, but it's hard to do it early on.
We're talking to Martinez Magala. He is a medical student and he wrote the Kevin MD article, Why Medical Students Should Be Taught the Business Side of Medicine. The traditional view of medicine is that it should be kept separate from business because if you involve too much money in medicine, medicine becomes a commodity and it really detracts from what the ideal of what medicine should be. Now, what do you say to someone who responds to you like that?
No, I totally agree. I think that that's a valid point. And when I do discuss this stuff, it's really not about necessarily ways to make money, but it's just to have an understanding of these kind of basic concepts so that, because no matter what, doctors are high earners, no matter which way you slice it. It's not at the expense of patient care or anything like that, but they are high earners and they have to know how to be responsible with their money and to manage it. And I think it is beneficial for patient care ultimately when you can kind of learn about this stuff and not have to, worry about it later on. You can just focus all your attention on caring for patients as opposed to being stressed and worried about finances. The median debt for most people graduating medical school is about $200,000, which is not a small amount of money. And most people go out without having any sort of plan or idea of how to pay that back when they want to pay it back. And people are, paying off these loans for a big chunk of their life after they graduate. And I think, as I wrote about in my article as well, this contributes kind of to that high burnout rate that we see in medicine. one of the main factors that people cite is, these financial issues.
Mhm.
So I think from that standpoint, being able to, get some sort of education and training on this early on could actually be beneficial in the long run. And ultimately, what we care about is patient care. And I think it can help for people to focus on patient care and kind of dedicate as much of their energy as possible to that.
And for those medical students who may be listening to this podcast, what is your number one actionable tip that you could share with them?
My number one tip is that if you're at all interested in this or you want to learn more, don't be intimidated. Feel free to reach out to people that you know, reach out to me, reach out to, any mentors, any people in your schools. And there are plenty of resources out there that, if you just start little by little and start to read, a little bit every day or a little bit here and there, you will learn a lot in a very short amount of time.
And my final question, what's your take-home message you want to leave with the Kevin MD audience?
My take-home message would probably be that the business side of things and personal finance is an extremely important part of medicine. Like you said, we don't like to talk about it too much, but there's really no way around it. And I think ultimately it'll be beneficial if we can have some sort of basic understanding of this stuff. And ultimately it'll allow us to focus 100% on caring for patients and caring for ourselves as well.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much for having me.